Okay, so we finished on Wednesday talking about the panic over crack cocaine and the kinds of punitive laws, racially disparate punitive laws that came out of that. Let me catch us up to the slides where we are. Okay, and then we were just about to talk about the other side of the coin, right? We're talking about the laws and policies and responses to illegal drugs or street drug use, and we're turning our attention to the pharmaceutical industry. I want you to notice something that up till now we've addressed these issues largely separately since the late 19th century. We had a week on street drug policy, and then a different week on pharmaceutical drug policy, and they're getting closer together. And one of the reasons that they're getting closer together is we're building up to next week when we're going to talk about today's opioid crisis, which completely blows up those distinctions between street and pharmaceutical drugs. And that's one of the reasons why these two things are starting to get closer together. And another reason is that these stories often change at the same time. So when there's a big change in attitudes about non-medical drug use, attitudes about non-medical addiction, as we just saw in the lectures earlier this week, you expect a big change in how people are thinking about pharmaceuticals as well. Now, we have to catch up with the story a little bit. The last time we talked about pharmaceuticals was at the height of the post-war craze for sedatives, tranquilizers, and amphetamines. In the 50s and the 60s, these drugs were going wild. They were among the best-selling drugs, best-selling products in America, and they were causing lots of harm as well. Lots of addiction, lots of overdose deaths. And then this continued through the 50s and 60s, and then I was saying, just at the end of Wednesday's class, that this boom in the pharmaceutical industry was kind of shut down in the 70s. It's funny because if you look on TV, the 70s are the decade where everybody is wearing these huge bell bottoms and using lots of pills. But the 70s was actually a decade of restriction, of reining in those out-of-control pharmaceutical markets. And I'm going to give an example of how that happened by the quintessential drug of the 70s, a tranquilizer called Valium. You may have heard of Valium. If you haven't, it's a drug like Xanax, like Klonopin. It's in the benzodiazepine family. And it was introduced in the early 1960s as something to replace the barbiturates. Remember, barbiturates were these sedatives and sleeping pills that could be highly addictive and were also quite toxic. And overdose deaths, from barbiturates in the 1950s were pretty close to overdose deaths from pharmaceutical opioids in the 21st century. So it meant it was a big deal to have a drug that appeared to be safer than those. It was less toxic, so it was harder to die of an overdose. And although experts knew that it could be addictive, it was a new drug, a new class of drugs, and so only experts were aware of this fact that it could be addictive. And there was a lot of desire to have it be a miracle drug, to have it really be a perfect replacement for barbiturates, because there's a lot of anxiety in life, there's a lot of stress in life, and we really want to have a drug that can make those things go away without exacting a cost. So Valium might have been a really good innovation, a really good pharmaceutical innovation. It really was less toxic, and it really was quite effective in easing anxiety if it had been managed carefully. But this was the era when pharmaceutical sales were not managed carefully. And as a result, Valium was sold with all of the marketing hype and intensity and almost none of the restrictions and regulations that would be faced by products that are dangerous. In the classic style of the pre-1970s era, it was advertised as totally non-addictive, safe for everybody and their brother and their sister and their uncle. Advertisements, oh, hang on. Oh, I don't have the advertisements, so sorry. Advertisements, they emphasized the drug's value for affluent housewives, for students. There's this whole series, I should really put those onto the slide, shouldn't I? Of stressed out students, and it's like BA in this, and a DX in stress, DX for diagnosis, and then the solution is Valium. You could all be really just sailing through your mornings with me, according to these advertisements, if you were just properly medicated. These advertisements showed these affluent white people taking the drug because this was a way to distinguish. I mean, this is a drug that's potentially addictive, that makes you feel good. So in theory, that's supposed to be bad, right? You're not supposed to take drugs to feel good. But so they needed to stay on the correct side of that line that divides pharmaceuticals and drugs. And one way to do that was to show that the people using these drugs were not drug-using people. They were patients who, and we know because of what we discussed before, that there was a real racial and economic class logic that divided those two categories of people who were using drugs to feel good. So by the early 1970s, Valium, which didn't face a lot of regulatory restrictions, you could refill prescriptions once you had one, pretty much as long as you wanted. It was the single best-selling drug on the planet. It was also the single best-selling drug in the United States, with more than 100 million prescriptions written for it each year in the US. So it was flying high in the early 70s. But this was the period of time in which there was a broader reconsideration of the problems associated with drug use and addiction. And we talked about this from when we talked about the return of medical approaches to addiction last week. And when addiction was reconsidered in that way and thought of as a medical problem, one of the unexpected things this did was made addiction to pharmaceuticals more visible. Because if addiction was an illness that people could contract, that meant it wasn't a quality of like bad people who, you know, lived in criminal neighborhoods and were doing immoral things. It meant that it was something that could happen to anybody. And as a result, there was more attention paid to the problems, the vast problems of addiction and overdose to pharmaceuticals. Yeah.
So if more attention was being paid to it, were people starting to blame pharmaceutical companies, or were they just being ignored, similar to how alcohol, like bartenders were in the 50s and all?
Yeah, that's a great question. And what happened was, in fact, it really put a spotlight on pharmaceutical companies, particularly one pharmaceutical company in particular, Roche Pharmaceuticals, which made Valium and sold Valium. Once it became evident that there were a bunch of people who were becoming addicted or having other kinds of problems with these drugs, that really enabled people to tell a new story about what pharmaceutical companies were doing. And in particular, Valium became a target of a national campaign to try to rein in the drug and to explain what kind of problems it had been causing. So in the 1950s, you may not remember this because a few weeks ago, one of the strategies for selling pharmaceuticals was to have these, they styled themselves as freelance science journalists, but they were actually on the payroll of pharmaceutical PR firms, and they would write articles in like Glamour magazine or Vogue saying like, this drug can cure all the, whatever everyday problem you're facing. Your kid is misbehaving well, maybe give them this drug, or you don't want to sleep with your husband anymore, well maybe this will help you. And then they could make claims that you could never make in an advertisement because those were overseen by the Food and Drug Administration. But this was journalism and, First Amendment and all that. So what happened is once awareness of Valium addiction became widespread, particularly Valium addiction among women, there was a different group of people writing for those same magazines, but instead of writing, this drug is, a wonder drug that'll cure everything that ails you, they were now trying to warn women about the problems associated with using this drug. In a Vogue magazine, it's not you don't think of a Vogue as a go-to place for either public health information or of the politics of women's issues, but Vogue magazine warned, talked to an expert who said, today probably it would be very hard to find any group of middle-class women in which some aren't regularly on Valium. But this isn't a problem for you individually. women out there, you thought something was wrong with you and you went to the doctor and they said, we'll fix you up. Actually, so many women are getting it that you have to wonder, is there actually something wrong with the women here, or is there something else going on? And this expert went on to tell Vogue and the people who are reading Vogue, it's a real problem that so many women are being prescribed Valium, because Valium dependency, when you do produce it, a physical dependence on Valium, she said, is a worse addiction than heroin or morphine. This is true. If you cut off use of an opiate, you will feel very terrible. Suddenly you'll feel very terrible for a while. If you cut off suddenly use of a tranquilizer or sedative, you may have hallucinations, you may have a psychotic episode, you may have grand mal seizures, and in some cases you can actually die, which is why they taper people off of these when they need to. So a new kind of argument about Valium was generated, and it was led by feminists who were saying, you know, if all of these women are unhappy and are going to the doctor and saying, I'm feeling bad, and then they're being given Valium, maybe it's society that has a problem and not the individual women. Maybe these women aren't sick. Maybe they're facing some common experience, some social experience that's causing their unhappiness. And maybe they had genuine complaints about, for example, the double workday. This was a period of time in which women's work outside the home was growing rapidly, and yet there was no changing cultural expectations about what women's duties were in the home. So you might go to work and then come home and still be expected to be running around cooking all the food and taking care of everybody while your husband sat around and read the newspaper after a hard day's work. Or maybe they were frustrated by the conditions at work or the inability to get promoted at work or whatever is happening there. And they're saying, well, these aren't things that that are problems of individual women. These are social problems. These are in fact political problems. Why should women take a pill to emotionally readjust to accept these crappy situations? Instead, rather than calling this an illness and going to a doctor, maybe they should say this is an injustice, and they should try to take steps to change things. As one witness at a congressional hearing on Valium in 1971 said, quote, "Tired mothers might do better in working in the National Organization for Women than in taking a pill." Now, this was not a radically new observation to make at this time. Second wave feminism was in full bloom. But one of the things about drugs is that it's easy to get the news media to talk about them because they produce these stories that are so interesting. They're tittillating, and people are fascinated by them. And so Valium became a convenient vehicle for getting these kinds of arguments, which, these were feminist arguments, for getting them into places that weren't necessarily places where you expected to find them, like Vogue and Redbook and Glamour and Good Housekeeping magazines, women's magazines like that. And so there was this, it kind of went back and forth. On the one hand, they were able to get more play for their arguments by emphasizing the Valium angle. Hey, women are being oppressed, and then when they complain about it, the doctor is saying, well, you're sick, here's some Valium, and then they're getting addicted to Valium, and it's causing all kinds of problems. This is a real social crisis. But this also had the effect of raising more awareness about addiction to pharmaceuticals and to Valium. One result of this, widespread conversation about use of these drugs. You can see a bunch of articles from the time right there. Was greater awareness that addiction was something that could happen when you took a pharmaceutical. And as a result, this is a little bit of a complicated graph, but it's basically the number of prescriptions for psychoactive pharmaceuticals. And the main thing to notice is that somewhere in the mid-1970s, they had been going up, steadily, consistently all throughout the century, and then somewhere in there, they had a big, sharp drop. And this group right here, the one that goes up most sharply after is actually antidepressants, which are not considered to be an addictive drug. So it has a dramatic impact. Doctors prescribe less, maybe women and also men were more skeptical of the prescription. If they received it, said to the doctor, is it really necessary? And you had a dramatic decline. And it wasn't just in Valium, although Valium is the one that I'm giving an example of. This is also when there were crackdowns on Quaalude. Everyone talks about ludes in the 1970s. Quaaludes were actually tightly restricted during this decade, and eventually by 1981 became entirely illegal. And same with amphetamine. The number of reasons that it was legal to prescribe amphetamine for people were shrunk until it became almost nothing. Almost, we'll find that almost is important, we'll find next week. And accompanying this incredible contraction of the market for pharmaceuticals, there was a sharp drop in the number of emergency room visits to people who had been using these drugs, and a sharp drop in overdose deaths. And that requires just a little bit of explanation, because typically if you contract the legal supply of drugs that you know what's in them, people then would turn to buy more of those drugs in non-medical markets that are unregulated and more dangerous. You would expect to actually see, you wouldn't expect to see that the health harms go down with sales of the pharmaceuticals. But the 1970s was that same time period where we're talking about a massive expansion of addiction treatment in the United States. There was it expanded from almost nothing, like literally like 2 or 3 places in the entire United States, to being a vast industry that we talked about with all these different forms, from methadone maintenance for opiates and therapeutic communities, and a wide different range of tools. And so at the same time as you started to reduce the supply of these drugs, you were massively ramping up the kind of treatment that was available to people who wanted to stop using them.